Hello, my name is Christopher Ray, and today I'll be presenting my research proposal titled Client Perceptions of NSP Staff Interactions in a Prohibitionist Context. This study explores how interactions between staff and clients within needle and syringe exchange programs influence whether clients feel supported, stigmatized, or controlled. Understanding these dynamics is crucial for improving harm reduction services, client engagement, and overall health outcomes. Problem statement. Needle and syringe, needle and syringe exchange programs, or NSPs, are designed to reduce health risks like HIV and hepatitis C among people who inject drugs. While these programs have proven benefits, clients often experience a range of emotions depending on how staff interact with them. In prohibitionist contexts, such as Sweden, clients may feel both supported and monitored and controlled. These perceptions can directly impact whether clients continue to access services and the overall effectiveness of the program. My research seeks to understand these interactions and how they shape client experiences within harm reduction services. Introduction. Injection drug use remains a significant public health concern worldwide. NSPs are a core component of harm reduction strategies, providing sterile equipment, education, and referrals. However, clients face challenges such as stigma, criminalization, and social exclusion, which influence how they experience these services. Historically, restrictive policies in Sweden have created an environment where clients may fear judgment or surveillance. Understanding the background of these social and policy changes is key to evaluating how staff-client interactions affect client engagement and well-being. Research question. The research question guiding this study is: how do interactions between NSP staff and clients shape client perceptions of being supported, stigmatized, or controlled within the harm reduction system? Based on previous research, I expect that clients who experience respectful and empathetic interactions will feel supported and empowered, whereas clients who experience dismissive or authoritative interactions may feel stigmatized or controlled. The literature review. Research shows that NSPs reduce harm and can provide social support to clients. Manson, Samuelson, and Storbach, 2025. However, few studies have focused on the interpersonal interactions between staff and clients, leaving a gap in understanding how these dynamics shape perceptions. At the micro level, clients may feel shame or fear judgment. At the meso level, organizational practices influence the service environment. At the macro level, prohibitionist policies and societal stigma create structural barriers. Addressing these levels provides a more complete understanding of client experiences. Methodology. This study will use a qualitative research design employing semi-structured interviews and focus groups with NSP clients and staff. This method was chosen because it allows in-depth exploration of the interpersonal and context-dependent experiences that cannot be captured by surveys or quantitative methods. Quantitative or experimental designs were not appropriate because they cannot reflect the nuances of client perceptions in real-world harm reduction settings. The theoretical framework. This study is guided by social constructivist theory, which emphasizes the individual's construct meaning from their experiences and interactions. That comes from Farmer and Farmer 2020. In addition, symbolic interactionism informs the methodology and analysis, focusing on how social cues and interactions shape behavior and perception. These frameworks help interpret client experiences and understand the social and organizational factors influencing perceptions of support, stigma, and control. The data analysis software. Data will be analyzed using Vivo, which allows for systematic coding and organization of qualitative data. Thematic analysis will be conducted in 3 stages: open coding to identify initial ideas, axial coding to connect related concepts, and selective coding to identify overarching themes. In Vivo also allows visualization of patterns and supports rigorous documentation, ensuring transparency and credibility in the analysis process. Implications for practice. This research has several practical implications. Findings can inform staff training in empathy, cultural competence, and trauma-informed care. Programs can enhance client engagement by improving communication and reducing stigma. Additionally, the study can also inform policy decisions to make harm reduction services more accessible and equitable. Ultimately, understanding client perceptions can improve both program effectiveness and client outcomes in NSPs. Impact of culture, diversity, and oppression. Clients accessing NSPs face multiple layers of marginalization. Gender, sexual orientation, age, race, social class, and disability can all influence client experiences. For example, women may fear child welfare involvement. LGBTQ+ clients may face discrimination, and racial minorities may encounter systemic bias. Staff must provide culturally competent, inclusive, and non-judgmental care, while policies should address structural barriers that limit access and equity. Ethical considerations. Ethical considerations are central to this research. Protecting confidentiality and obtaining informed consent are essential, as participants may fear legal or social repercussions. The research will follow the NASW Code of Ethics 2021, National Association of Social Workers Code of Ethics, emphasizing dignity, self-determination, and social justice, minimizing risk, avoiding harm, and providing resources are critical to conducting ethical research with this vulnerable population. Recommendations. Based on the study, I recommend ongoing staff training in harm reduction, empathy, and cultural competence. NSPs should implement client feedback mechanisms to identify areas for improvement, collaboration with peer support, and community organizations can enhance outreach and inclusion. Finally, findings can inform policy advocacy to reduce structural barriers, improve access, and strengthen the quality of harm reduction services for people who inject drugs. There's my references. Thank you for listening. Have a great day.